How do you then, in your opinion, manage the ability to get a message out, even a blueprint message or fitness message or just health in general message? Really, how do you operationalize that when you have so many of those forces that come against it?
It's increasingly complex to do that, and I think part of that is, yes, utilizing different vehicles to get that message out and understanding where do people get their information and who are you trying to reach, and are you ensuring that the outreach that you're doing, not only does it resonate, but is it culturally appropriate? Is it meeting the needs of diverse communities? And recognizing that you may not always be that messenger, and that there are others in communities that are the trusted messengers. And so again, building those partnerships so that they too are empowered to deliver the message.
We spend a tremendous amount of time collecting the dots. We need to spend just as much time in connecting those dots. And that's what Public Health Connects is all about. My name is Dr. Umair Shah. I'm the Secretary of Health for the great state of Washington. This is Public Health Connects.
Again, here at APHA with our Public Health Connect series, where we not just spend time collecting the dots, but really connecting those dots. And I can't even tell you how happy I am to have Dr. Nadine Gracia here with me to spend time, the President CEO of Trust for America's Health. And you have done everything, practitioner at the federal and Office of Minority Health. You are just an amazing leader, incredible to have you a part of this. So thank you so much, Nadine, for joining today at our Public Health Connects at APHA.
It's great to be with you. Thank you for the invitation.
Absolutely. So I just gave a little bit about who you are. Why don't you take it from there? Tell us a little bit about who you are and even talk a bit about what your team is up to. I think it's been a little busy time, I would think.
It has been a busy time, and it's wonderful to be with you here at APHA as well. So our organization, as you said, TIFA, Trust for America's Health, we're a nonprofit organization. We're nonpartisan. We're a public health policy, research, and advocacy organization based in Washington, D.C. And our work, what we do is we work to advance policies that are going to promote health and well-being for every person, every community, and focusing really at the national level, how we prevent illness and injury and make that a national priority. So we focus on policy priorities like public health funding, public health emergency preparedness, obesity and chronic disease prevention, mental health and addiction, as well as healthy aging. So
everything
many
really,
issues.
pretty much, yeah.
Now, as you said, it's been a busy time. We just recently released our blueprint report for the next administration in Congress to strengthen public health. This is a report we release every 4 years for the incoming administration in Congress. Sets forth really a roadmap on how to improve health and well-being and strengthen our nation's public health system.
Oh wow! So, and I was in DC when that report was released, and I guess I should say disclaimer that I am on an advisory board for TIFA. So really proud of the work that you do and your team, the incredible team, does as well. So this is being taped before the election, and it will be aired after the election. And we have a lot going on. And you talked about the blueprint and really thinking about what are the priorities potentially from a health or a public health standpoint. Can you walk through some of those? And I want you to use the lens of nonpartisanship. So this real notion of it doesn't matter who wins. It's really about how do we make sure the American people win, and how do we do that from a health standpoint?
Absolutely. The Blueprint Report, as with all the work that TIFA does, is nonpartisan. It's rooted in the data, it's rooted in evidence to really highlight what are the policies and programs that are actually going to help promote health and well-being. And so when we think about this is regardless of the outcomes of the election. We know that investing in public health and supporting public health is going to be critical for this incoming administration and Congress. The way we actually developed the report was actually through convenings with experts, with practitioners, with community members, as well as research to identify those policies that are most instrumental in addressing public health and the health security of our nation. So it cuts across really 6 areas, 6 priority areas. One is ensuring that we have a public health system that's ready to meet the growing health challenges and threats of the 21st century.
Okay.
And that requires a strong and robust public health infrastructure and workforce.
Okay.
Another area is the readiness, bolstering our readiness for health security threats. Another is how do we promote health and well-being across the lifespan, and then also advancing health equity. Then we also address the non-medical drivers of health, which we know are so critical to health outcomes.
Like housing, transportation.
Housing,
yeah.
transportation, food security, our built environment, and ensuring that the community conditions actually promote health and well-being.
Got it.
And then lastly, it's protecting the scientific integrity of the federal public health agencies that are charged with ensuring the health and well-being of the nation.
Wow, there's so much, and we'll put a link on this so that people can actually get to the report. Talk a little bit about this real concept of investment. You know, we oftentimes have this real challenge, right? Physicians, we know everybody thinks when they think of health, they think of healthcare delivery. They think about bells, whistles, ambulances, emergency departments, hospitals, all those. And yet, it's really about that investment in prevention, in community health, and really thinking about how do we get to your point about some of those real drivers of health that are not always in the healthcare or medical system. Talk a little bit about how do we make that argument to those who may not be familiar with what we do or why we do it or why it's important.
Yeah, absolutely. I mean, healthcare, yes, is important when we talk about health outcomes, but what we also see is that we are spending, the U.S. is spending, the highest amount in healthcare spending of high-income nations, and yet when you look across high-income nations, we have the worst health outcomes. Public health and prevention actually can help us change those trends when you really look at the functions of what public health and prevention does. We spend more than $4 trillion annually in health spending. Less than 5% of that is going to public health and prevention. But when you look at measures like life expectancy, which is really an important measure of the health and well-being of society, a lot of the factors that have contributed to increasing life expectancy over the years in this country are rooted in public health interventions, whether that's improved sanitation, improved nutrition, tobacco prevention, injury prevention. And so it's critically important we're actually investing in public health and prevention because we're already paying for the cost of inaction. People can say there's so many costs that we're seeing, but actually we're paying for those costs by premature deaths, high rates of injury and illness, and then seeing the excessive costs that we're seeing, for example, in healthcare. And public health really is core to our infrastructure. It's part of our health security when we think about infectious disease threats, weather-related emergencies. It's important to our economic security and our overall national security. So it's really important that we as public health professionals, but also our partners in other sectors, really share those stories with lawmakers and other policymakers to understand how vital public health is to the health, security, and well-being of the nation.
Do you, and I love this, do you feel we're making progress on that front? You know, because we get drowned out by so many, whether it's, you know, healthcare or non-healthcare. I mean, there's so many other elements to the chorus that's out there that's always looking for investments and capacity for this silo, this sector, that sector. Do you feel we're making progress?
I think we're making progress in certain areas, and actually the blueprint doesn't only talk about the recommendations in terms of the sustained and increased support and funding for public health. It also should demonstrate some of the progress and policy milestones that we've seen over many years. It shows impact stories of how when you invest in public health and prevention, you can see improvements, whether it's in health outcomes or the capacity in communities. We've seen, for example, these new investments in public health infrastructure grants, helping to shore up the infrastructure and workforce, whether it's our data systems to be able to detect diseases and contain them more quickly, build and strengthen our workforce, which we know so many health departments are understaffed. We've also seen, for example, the launch of the 988 Suicide and Crisis Lifeline.
Sure.
Tremendous asset and resource in the first 2 years of its launch. That lifeline, there's been more than 10 million calls, texts, and chats demonstrating the need. So when the administration and Congress, when policymakers actually act in support of public health, we can truly make a difference. A big challenge, though, has been often the way that public health is funded. It's often in this boom and bust cycle where it's an emergency happens, there's this influx of emergency funding, it goes to support that emergency, and then the emergency ends, and either the funding ends or it's redirected to another priority.
Our attention goes the other direction.
Our attention goes another way. It's out of the headlines, it goes another way. That's not the way to really sustain and modernize and strengthen our public health system to be able to address the day-to-day health needs. That's chronic conditions, that's mental health conditions, that's the community conditions like we were talking about earlier, in housing, working with partners in housing and transportation, so that we're a healthier, more resilient community that's also then better prepared for the next health emergency.
So let me bookmark that because there was another piece that I failed to mention, that you're also on the President's Council, and I always get the
on
full
sports, fitness, and nutrition.
Thank you.
Yes.
And so that's all about health and wellness. And we're going to talk a little bit about that at the very end with our Be Well WA initiative, so we'll talk about that. But tell me a little bit about, from that lens, when you're on, I'm assuming it's an advisory, gives recommendations to the president or the president's team about, like, what can we do to improve or enhance health, wellness, fitness, nutrition across the spectrum, across the country for all Americans. So how do you go about, maybe in your mind, reconciling recommendations that are at a theoretical level, and this is even with the blueprint, right? Theoretical level, to what happens in a local community. How does that all, in either, but I'm really interested in the council, how does that really get to the everyday average American and how it plays out for their lives?
Yeah, I think importantly, the work of the council is to support, and provide information on how do we actually improve health and well-being through fitness, through healthy nutrition, raising awareness of healthy nutrition, and being in communities to do that. When President Biden, for example, hosted the White House Conference on Hunger, Nutrition, and Health, it really put a spotlight on this issue, the rising rates of diet-related diseases, and mobilizing and saying, this is not only a government effort, this is a whole of society effort. So we as a council, for example, raising awareness by partnering with the sports leagues, major sports leagues, professional associations, because many of them have community-based programs to help support and engage youth. Exactly, to engage youth around the country in physical activity and sports, but also expanding to increase awareness of healthy nutrition and education programming. We've seen partners, Washington State Department of Health, for example, that made commitments to saying that there are ways that we, not only in public health, but in the healthcare sector, the business community, employers who are stepping up to say there are efforts that we can take, whether that's providing information and education to our workers or the communities that we serve, but also working to change the environments in which we're in. Food and Drug Administration, for example, the work that they're doing to make the food environment healthier through voluntary sodium reduction goals that they're implementing, which we're seeing with regards to commercial packaging foods, that they're actually seeing the reduction in the levels of sodium in foods and doing that through a stepwise fashion. Or the process they're now undertaking to develop a front of package label to help inform consumers so that they can make a healthier choice. A lot of this is about opportunity, providing the information, but making sure that the healthy choice is the easy choice, and knowing that it's not just the public health sector alone or any sector alone, but that all of us have a role to play. Absolutely.
So it's interesting because that really speaks to this real notion of it that cuts across political divide, politics and partisan divide, and even different types of communities, because ultimately we're saying, look, it's health and well-being, and that is what we should all be a part of, and that's what we all have a responsibility for. So I love that. Let me segue for just a moment into, I know you know this, that our agency has really gone through a lot of transformative work, transformational work. It's really been on 3 cornerstone values of equity, innovation, and engagement. And those 3 EIE values have been such core to the work that we've done over the last many years, but especially over the last couple of years. And when you hear these, does anyone, and I know they do, so this is like, I know there's going to be an answer. The answer is yes, but do anyone really strike you like core to your soul, or something that you really believe strongly in of those 3, or the intersection of those 3? And then I'm going to ask you how you think we have some challenges, or maybe one big challenge of trying to operationalize something like that. That's so again, theory to how does it play out in in our work.
Absolutely. Well, I'm glad you gave me the option of the intersection of
Yeah,
the
yeah.
three, because I am going to say
Love
that
it.
they all three resonate. They resonate
Yeah.
for me. They resonate for TIFA.
Yeah.
Because they're core to foundational policy making, and they're also core to sound public health policy and practice. When we talk about equity, innovation, and engagement, when you think, for example, about innovation, I mean, we are seeing these evolving health threats and risks. They're becoming increasingly complex. Our nation is rapidly changing, so we have to be innovative when we think about the types of policies and the programs that we are implementing for a nation that's rapidly changing. When we think about equity, that's so critically important because, as you well know, health disparities have long existed, well before the pandemic,
Right.
but are rooted in many of the structural barriers,
Systems.
And so when we think about that type of policy making, when we actually improve those structures and systems, it not only helps the populations that are disproportionately impacted by poor health outcomes, it actually helps populations as a whole, communities and our nation as a whole, both in terms of the human toll as well as the economic toll.
So it's almost like, if I can
Yeah.
paraphrase that one before you get to your next, is this, it allows us to put our best foot forward as a nation.
Absolutely.
That we all show up because we're all working together
That's
to
right.
address those issues.
That's right, because you think about it, it's then having healthier children who then become healthier adults who are healthier workers.
yeah.
And then we think about that in terms of our overall health and well-being as a nation. It makes us have a competitive edge.
Yeah.
We're more prosperous as a nation because we spend an inordinate amount on health, preventable health disparities. It's not sustainable. And so why would we want to not center equity when we realize that that's actually a tool and a lever for us to assure that everyone has that fair chance and opportunity to be as healthy
And then
as
we as a
possible.
nation thrive
And then we
because
as a
of that.
nation
Yeah,
thrive
okay.
because of it. Indeed,
Good,
indeed. And then that connects then to engagement, because you think, how do I then advance these innovative, equitable policies? Well, in part, you have to actually ensure that you're engaging, that you're not just creating these policies in a vacuum. Like you just said, how do we assure that this is really meeting the needs of communities and people who are in the front lines? And so that's ensuring that you're engaging with community. You're hearing from those who are directly affected by these policies or those who are implementing those policies. And I think that's critically important because it also helps to earn trust and
Yes.
ensure that organizations such as ours, institutions such as yours, are seen as trustworthy partners, and that we're also ensuring that we can address things like mis and disinformation that communities may be receiving that can impact that ability to engage effectively.
And that world has really changed, right? When you know, just to pick up this last thread about misinformation, disinformation, world has really changed, right? It used to be, I guess, a long time ago, where you would just have, one or two or three, channels on the TV, the black and white screen, all those things. Unfortunately, I remember some of this at least, and you have now just 24/7, and anybody can post or do something, or you have even some algorithms that say like means that in your feed you'll get more of the same. So how do you then, in your opinion, manage the ability to get a message out, even a blueprint message or fitness message or just health in general message? And I know I asked about the intersection. I absolutely, you talked about EIE, but I'm really, really, how do you operationalize that when you have so many of those forces that come against it?
It's increasingly complex to do that, and I think part of that is, yes, utilizing different vehicles to get that message out and understanding where do people get their information and who are you trying to reach, and are you ensuring that the outreach that you're doing, not only does it resonate, but is it culturally appropriate? Is it meeting the needs of diverse communities? And recognizing that you may not always be that messenger, and that there are others in communities that are the trusted messengers. And so again, building those partnerships so that they too are empowered to deliver the message. We know, for example, with the Blueprint, we're so fortunate. We've had numerous organizations who've endorsed
Very
the
well
Blueprint.
received, yeah.
We have others that are continuing to help promote the Blueprint, and they're doing so by sharing it within their organizations, with their networks, and they're seen as trusted voices in those networks and communities to be able to say, this is why this is important to our community. So that's critically important. We can't do things in silos anymore. And we also have to recognize that we need to provide resources to communities. Another challenge, not only of the underfunding of public health and the public health system, but has also been looking at community capacity. So many community-based organizations that do vital work each and every day, but yet don't always have access to the resources. And that's something that we recommend as well in the blueprint, is assuring that that funding is also reaching community organizations that have those trusted relationships to be the messengers, to be able to also ensure that they have a seat at the table and that we also join their tables to hear from them, to learn from them, be humble and authentic in our partnerships.
I love that. In fact, we at our agency, we don't even call them community-based organizations. We call them community-rooted, or because they really have roots in the community, and that's how you blossom together. So let me, by the way, we could go on for a long time. I've had so many questions to ask, but let me move to, and we talked about challenges and even some of those opportunities. And again, this will be right before the end of this 2024, this calendar year, when people will see this. And I'm curious if you could talk a little bit about hope for, again, we could talk 10 years, 20 years, 30 years, 50 years from now, but what's your hope for next year? Let's say perfect world according to Dr. Gracia, you're gonna, blueprint is out there, administration, regardless of which side wins, they see the blueprint, they understand what are some of the, hopefully will embrace some of the real tenets that are in there. What gives you hope as you look at public health next year in that short term about what would success look like next year?
Yeah, absolutely. There's so much conversation happening about that there's public health has been politicized, and we're in such a hyper-partisan environment. But when we really look at and actually look at across the recommendations of the blueprint, there are many that actually enjoy bipartisan support. We can point to things, for example, such as addressing the mental health crisis, substance use prevention, that enjoy bipartisan support, protecting the nation against the next pandemic. It's how we do it. There may be differences, and we know, for example, that the political divisions, they aren't going to disappear.
And they're not just public health, they're societal.
That's societal, and that's not going to disappear in the near future. But it's important that we talk about the value, the best buy of public health. And what gives me hope is who I see here at this conference and who we work with each and every day, just dedicated, not only public health leaders and organizations and communities, but other sectors that are also stepping up in support of public health, whether it's healthcare. We see that, for example, through coalitions like the Common Health Coalition. Whether that's other sectors like the business sector. We're partnering now even more with the business sector, for example, with our partners in the Health Action Alliance that are now working on issues around extreme weather and climate risk and what that means for workers. These other sectors are stepping up, and what it's showing is the power of multi-sector engagement, raising voice and being able to understand when these issues happen in public health, they affect every part and every aspect of our society. So in this next year, I anticipate that we're going to work with this administration, with this Congress, to make the case of why investing and supporting public health is good for the nation as a whole, and that it really helps to advance their agenda of strengthening our resilience, our preparedness, and really the opportunity. And that's what we stand for as a nation. When you can align with those values, when we can identify some shared values, I think that's when we can truly make progress as a nation.
Oh my gosh, I'm sold. I'm sold. You're such a convincer. I am sold. Okay, so let me close with, I'm going to pull this apple, and this is our Be Well Be Well Washington apple, and as you can see, it's kind of a stress apple too, so do not eat this apple. But we have fantastic apples in Washington. If you ever want to come, we can absolutely get you some apples there, different kinds, all varieties. This is our health and wellness initiative that we launched recently, and it really underscores on some things that you really touched on. Movement, nourishment, emotional well-being, social connection. And we've been saying to 8 million people, find your apple. What's your apple? And some of you be like, hey, my apple is walking, my dog, or walking my cat. Others say it's reading a book or what have you. So I will give this apple to you. And as I do that, I ask you, Dr. Gracia, what is your personal apple that gives you that solace or grounds you?
I would say, and it's one I'm excited to receive the apple. What I would say is it's truly my faith, and it's something that was instilled in me through my parents, because it's through my faith and my parents that I understood respect for others, of caring for others and caring about others and being kind. And that is rooted in everything that I then do, not only personally, but also professionally. And so when I want to center myself, when I want to understand, even with the numerous challenges that we face across society, my faith grounds me, it motivates me, and it also makes me understand how privileged I am to hold the seat that I do, that to provide opportunity for others who may not have opportunity, that's a calling and that's a privilege.
Oh my gosh, and thank you for what you do every single day. The apple is yours. There you go.
Thank you very much.
Thank you, Dr. Gracia.
Thank you. Thank
Public
you.
Health Connects. This is so fantastic. Really appreciate the time and the space today.
Thank you, and thanks for all that you do.
Absolutely. Thank you. Thank you, Nadine.
Thank you.